It goes out.
You want just to fill all this shit in?
Yeah.
Fill this.
You don't fucked up those borders.
They already like that.
Oh my god.
Who's Natalie? Okay, I guess I'll. Who? What is Natalie's other? Is there a Natalie Ruggieri in your class? I know. I'm seeing somebody signed in as her. I wonder if it's just under a different name. Should I let him in?
Yes, that's Brett. That's his girlfriend's name, Nat.
Thank you. Does this mean his new nickname is Natalie? Okay. That's everything.
No, we're Madison is trying to get in.
Yeah, she's signing in, and Trevor too. Bridget, what was so funny? What are you guys laughing about?
You guys, literally everyone is laughing at us right now. Shut.
Okay. I'm going to start laughing just because you're laughing. Yes. And Brett, can you fix your lighting so that I can see you? And Tom, you want to turn your camera on? Very good, thank you. You guys aren't going to share? So you're laughing over something that we can't know about?
The echo.
Oh, over the echo? Okay, what was it me that was causing the feedback? It might be with my speaker. Okay, it was you with the headphones, Tom?
No, it's us.
And she's like, just stop, Tom, huh? Okay, and Alicia got kicked out, needed to get back in. Okay, cool. I like to sign into my other computer because am I the only instructor that sometimes has problems with my internet the moment I get on class? Like I never have issues with my internet connection until it's like the most important part of the lecture, and then all of a sudden I get this internet connection unstable and then it has to like reconnect. Does this happen to you guys too? Who here has a problem with once I go to share the screen and share a PowerPoint that you have like decreased bandwidth and have issues with that? No? Maybe my other class is just doing that so they don't have to keep their camera on, huh? So hi, I'm Ms. Penelope Erickson. I go by Penny. I know you have to call me Ms. Erickson. So I'm your instructor for Nursing 126 for your second semester main nursing course, right? The one that's 7 credit hours, the big one. It's nursing's role in health promotion and maintenance. So today is going to kind of be a little bit of review, but it's also hopefully going to be taking what you know and thinking about it maybe in a broader context, right? Thinking about now that you're in this role of a nurse, how does that look when you're out there interacting with people, right? What do we call these people? You know, some people call them patients, and then, you know, in nursing we said, well, that's not right. That's a more derogatory kind of term. You know, we're the nurse, they're the patient. And then we're like, really, they're our customer. And oh, now we're going to call them client, because that's so much better. That's so much more personal, isn't it, to call this, you know, person a client. So I would kind of like to just call them a person, right? The holistic person and that person-centered care that we, you know, that we want to talk about. And if you notice on the front of your textbook, it talks about person-centered care. So I kind of like that, you know, nursing's role in health promotion and maintenance, right? And looking at the person, that holistic person. So we're going to talk about, you know, health and wellness and illness versus, you know, disease, and look at the different levels of health promotion again, look at the different aspects, look at Maslow, look at developmental, you know, theories a little bit, and the professional role of the nurse, okay? So really, my goal for today is to give you this vision of what this course is about, the different concepts. You know, what is a nursing concept? What are the exemplars? What does that mean to have an exemplar of a concept? And why is this important to us as a professional nurse? Why are you in a conceptually based nursing program? What's the value of that? What does that mean? Okay, so that's what we're going to talk about and learn about today. So let me go ahead and share. I'll pull up my PowerPoint, because that, you know, it does provide kind of a nice framework. But you know, in this class, I don't want to just lecture all the time. I do want to do different kinds of formats and things. Let's see. I like how all of a sudden it's not recognizing my flash drive at all. I'm gonna go ahead and put my flash drive on my laptop. Okay. So another thing I want to do is do you guys know Monique and Esme and Jess, the 3 new students that are joining your class? Okay. I I want to advocate for them and let you know what smart, great students they are. Okay, so they're going to be an absolute bonus to you guys. They're, you know, so welcome them in, glean from their knowledge. They're really good students. Okay, so they're definitely benefiting your class. Okay, so that's my plug there. I want to make sure that that they're able to transition easily into your class because they're excellent. Okay. Okay. I'm just getting into Zoom with my other laptop so I can use my flash drive. That's weird. It's not letting me join the meeting. It's making me start the meeting. Why can't I just join? I apologize. Hang with me. It's first day jitters. Okay. So now it's me. So Tom, my partner's name is Tom White. And when I
Yes,
first
ma'am.
met him, I ran into him at a Jamba Juice one day. Okay, this is kind of an interesting story. Years ago, Eric Height, the police officer, the day he was shot, I went to church and I was kind of bored. I got put on call at work at TMC. I was put on call and I had gone to church and I thought, you know what, I'm going to go run up the road and go to Jamba Juice. So I'm in Jamba Juice. And while I'm there, the one on Sabino Canyon in Tanque Verde, and while I'm there, all of a sudden, all these police cars go racing by and they close the overpass there on Tanque Verde. And I was like, you know, what's going on? I was on call at work, so I like called TMC and I said, you know what? I'm in my church clothes. If you call me right now, I can't, I'd have to come into the hospital in my street clothes because I can't get home right now. They just closed the overpass. And they're like, nobody knew what was going on. Well, this man overheard my conversation and he came up to me and he said, here I'm on my phone, I'm on my cell phone, I'm trying to get some information on what's going on. I'm not seeing anything. And I said, oh, okay. And he goes, oh, so you're a nurse at TMC? And I said, yeah. And he said, you know, there was this little girl that we took x-rays on. Maybe you know who, and I just looked at him and immediately I knew who he was talking about without saying anything, right? Without saying a name or anything. Because there was this little girl who had gotten very physically abused and she had a lot of fractures. She had a liver and another organ, spleen, something laceration. She was put on TPN and lipids. This little girl was amazing, by the way. That's a whole nother story, right? She she kind of decided she was going to change her name and she wanted us to call her Mia. She was like 2 years old. And she got this little wand and she was in the wagon. She was telling us to pull her around the unit and ordering us where to go, right? Because she was becoming autonomous and mastering her universe now because she had been abused, right? So anyway, he looked at me and he said, maybe you know this little girl. And I said, yes, she's doing really well. You know, of course, we both knew we couldn't talk about it because of HIPAA. And so he got talking to me a little bit. This is how I met my partner now. And his name, he told me at the time, he's like, yeah, my name is Tom White. And do you know what I said to him? not that I, you know, mean to be like overly cautious or anything, you know, or cynical. But I said, you want me to believe that that's your real name? Right? And he said, here, and he pulled out his driver's license and he showed it to me, you know, and I said, okay, so you're really Tom White. But so when I was, you know, I like to go through your pictures and stuff, and I was looking and I thought, well, I'm going to have to tell Tom. Have you ever gotten that from any women that you've met, you know?
I've gotten that from tons and tons of people. I've had to verify that I was really Tom Smith multiple times.
Uh-huh.
It happens a lot.
That's funny. And I'm sure there probably are a lot of Tom Smiths out there also, right?
Yeah, there's a lot of us. Like, I can't even travel internationally without doing specific interviews with DHS because they all think I'm a pseudonym or something like that.
Uh-huh. What would be your trauma name now, right after Tom, right?
I don't know what a trauma name is.
Well, like you know, like if somebody's unidentified, they'll say it's a John Doe, right? So, you know, like.
Yeah, I already talked to my classmates. When we go into Sims and things like that, I ask them not to call the mannequin Mr. Smith.
Right. And come up with something else more creative, huh? So now, are you just seeing are you seeing the PowerPoint? You're just seeing this. So I'm going to, well, that doesn't work. Okay. Because I think it's on my co-host screen. Let's try it again. There we go. Nursing's role in health promotion and maintenance, right? Because the cost of going to the emergency room, what is it, Selena? What do you think, how much does it cost to go to the emergency room?
Like 10 grand.
That's a lot. Okay, so you had some things, you were there in the emergency room like all day, right? Okay, and then they do EKGs, they work you up, you end up having to go to the cath lab because they see that your EKG, you have a ST elevation, right? So you got the P wave, the QRS, and then the T, and that QT segment, right? The ST segment is elevated. It didn't come back down to baseline. We're going to learn about that. That's a sign of a heart attack, right? That's a STEMI. Have you ever heard that, like, they throw around terms in healthcare? Oh, it's a STEMI. Do you know what STEMI stands for? ST. Do you know like the waveform of the heart, the PQRST? You know, the ba-dum, 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 you know? You know what a heart rhythm looks like, right? The peak spiked thing is the QRST. That's when the ventricles contract. If after that, it doesn't go down, it means that the ventricles have damage. The heart has damage. So that ST segment is elevated. So STE is for elevation. Myocardial infarction means heart attack. So STEMI means that ST is elevated, myocardial infarction. ST elevation, myocardial infarction, STEMI. Okay, so this guy's got a STEMI, he's got to go to the cath lab. Morgan, how much does the cath lab cost?
I am not 100% sure, but I would say at least $1,000.
At least, yeah, a lot, right? And then the anesthesiologist, and then, you know, the cardiac surgeons, you know, the cardiologist fees and all that stuff, right? And this, that's scary, right? Who wants to have to go into the cath lab and have, you know, a cardiac catheterization and have a stent placed, right? But let's say they can't stent it. Let's say that there's a blockage right at the bifurcation of those arteries that feed blood circulation to the heart, right? And they have to rate, you know, that patient now has to get admitted and go for an open heart surgery, right? And then they're hospitalized for a long time and that whole thing, right? Plus, this is like the leading cause of death in our country. Isn't it something that when we look at heart disease, to think that, you know, look at our diet and look at, you know, how much we sit all day and all these things, and how when you leave campus at school, you're driving by like 20 fast food restaurants to get to your home. And heart disease is the #1 killer, and yet it's so preventable, right? So, you know, this arterial sclerosis, atherosclerosis, all that. So the cost of all that, the cost of life, right? Like if we wanted to put a dollar sign on the quality, you know, what is a good quality life year worth? Like $100,000, right? If we wanted to put money on that. So, you know, I like to like introduce this course as saying, going to the ER, you know, $1,000 or so. Going to the cath lab, another $5,000. Have an open heart surgery. Now you're getting up to, you know, it could be like $30,000. Preventing heart disease in the first place, priceless. Remember the old, you know, American Express commercials? Maybe I'm dating myself. It was a great slogan. You know, doing this costs this much, doing, you know, seeing your kid grow up and go to college, priceless, you know, that kind of thing. So I'd like to say preventing heart disease in the first place is priceless, right? As nurses, if we can promote somebody's health, if we can look and identify risk factors, if we can prevent people from getting diabetes, becoming obese, having cancer, right? Having skin cancer, all the things that we can prevent, getting COVID-19. Is COVID-19 preventable? What % of cases of COVID-19 do you think are preventable? Okay. Melinda Roberts.
Hi, I would say a lot of them are preventable. I think that if you're being careful, not you're social distancing, you're making sure that you wear your mask, everything.
Exactly. So if people don't come in contact with each other, right? What percent of that disease is preventable then?
100%, theoretically.
100%, right? It is. And, you know, a lot of injuries, think about like injuries that children sustain, right? Think about like, we don't call it near drowning anymore. We call it submersion injuries, okay? How many, I know, you know, like we like to call them accidents, right? Isn't it nice that we call them accidents? And you know what? I would not say this to the mother that brings her child, comes with her child into the emergency room when she found him at the bottom of the pool, right? I wouldn't go to her and say, you know, this was 100% preventable. Of course, I'm not going to say that. But what's my heart saying? My breaking heart is saying, this was 100% preventable. This isn't an accident. This is a preventable injury. This is a preventable infection. This is a preventable disease. This is our role as a nurse. Are you feeling the passion? And this is the beginning, right? Because how you build in this nursing program, you're going to start here with pretty stable patients in a long-term care setting, and you're going to go to clinical and you're going to learn to take care of them. You're going to learn to do your head-to-toe assessment and identify what's normal, you know, with your different body systems and your different, you know, concepts of oxygenation and circulation. What does that look like in, you know, when it's working correctly? And then what are the pathos? What's the abnormal? What are the signs and symptoms? You know, what does this mean? And looking at that. But every time that you interact, so you start with your stable patient, and then next semester you're going to go into acute care. You're going to go into the hospital setting, and your patient's going to be sick. And then you're going to move on 4th semester. You're going to take more of a challenging patient. And that's, you know, nurses rolling with challenging situations. And then 5th semester, you get into that critical patient, you know, that critically ill patient, and you're going into clinical in the ICUs. Whether you're in long-term care, acute care, a more, you know, a more challenging patient, or you're a critically ill patient, whenever a nurse interacts and cares for a person, you have that opportunity to educate, right? To change lives, to inform, to give information, to motivate, to make people maybe realize, you know, it's kind of like sales, right? What's it going to take to get you in a new body today? What's it going to take for you to make that change? And we talk about that. Did you learn about that last semester, the stages of change? Maybe you're contemplating it, you're considering it, you're coming up with a plan, then you're implementing that plan, and then it comes into that, are you going to maintain it? Is this going to be your new lifestyle, right? There's like 4 changes, 4 stages to implement those health promotion changes, right? So, you know, I like to really think about that, because that's hopefully one of the reasons why we go into nursing, right? Is because we want to make a difference in people's lives and we want to promote health. So isn't this all about it, right? The nursing's role in health promotion and maintenance. So a little bit about me. I have my master's. I also am a certified pediatric nurse. So that means you do extra classes and you take a test to become certified. For a long time, that was a big dream of mine, and it costs money to take the test, right? So I was really glad, like 8 years back, TMC made this commitment to pediatric nurses, to a lot of the nurses in their different specialties, for them to go and get their certification, so that they could kind of, you know, promote that and say, hey, we have these, you know, high level nurses, they're certified in their specialties. You can be a certified neuro nurse, surgery nurse, all different kinds, right? And depending on the market, sometimes if you're certified in a specialty, it means more money. Like for a while there, certified neuro nurses were getting like $7 more an hour at TMC. So peds wasn't the same deal. We didn't get more money for our certification. We just got the pride part of it. So I've maintained that. So back in '85, I got my BSN. Saginaw Valley State University is near the Tri-Cities. We like to show, you know, here's Michigan, here's the UP, right? Here's Bay City, right in the Thumb area. Saginaw, Midland, and Flint is nearby. Where they kind of got put on the map there because of their lead in the water, you know. Midland has Dow Chemical there. So, you know, there's Midland recently flooded too. So I moved out here from Michigan. You know, here I am, nursing student, driving on icy roads at 6 a.m. to get into the hospital, right? Everything's closed, but you know, you had to be there for clinical. So, and then driving to those other areas. I did like public health nursing as a student in some of these high rises in downtown Saginaw. It's kind of a dangerous area, and then driving out to Midland also. So I graduated from there in '85 with my bachelor's, and my dream was to move out to Arizona and get away from that snow. And actually, it was to become a pediatric nurse. So I was really glad to fly out and interview and land that job and pack up the U-Haul and move on out. And I stayed at TMC for 30 years. And during that time, you know, I worked as an assistant manager, and I did a lot of precepting with students, and I did adjunct faculty for the University of Arizona and for PMI. My friend Heather, who was a PICU nurse, pediatric ICU nurse, she wanted to do clinicals, and we had to do every other week. We had to do every weekend for clinical, and we had to work every other week, right? Because that's how it works. You have to cover your weekends on the unit. So we job shared that clinical. So it's all her fault that I'm here today, and TMC's fault, because they paid for me to get my master's. They paid 100%. They had a little program for a while called TMCU. It was funny. I have a bag. I'll show it to you sometime, a black bag, and it has the logo on it. TMCU, Growing Our Own. Okay, so their intention with that message was meaning that they were taking their staff and, you know, in promoting, you know, like furthering their education, right? But it really said TMCU, growing our own, no drug connotation in, you know, right? In that, right? So I thought it was funny. Anyway, you guys aren't laughing. Okay, anyway, you got it, right? I'll go on. So I just thought that was wonderful though, because they didn't just pay reimbursement, they paid for books and tuition and everything up front. So I feel like, you know, in our lives, isn't it true that you need opportunity, right? You need that time, and we don't take it for granted. When we have the opportunity, you know, you have to take that time for yourself. You have to put yourself first and learn everything you can. Okay, so this is me being there, right? Talking to you here, right? That this is your moment, okay? This is your opportunity to make the most of it, to learn everything you can. You've got every resource you need to be successful. The point is awesome. The library, PMI library. I remember getting in at University of Phoenix and being able to, you know, do the searches in EBSCO and ProQuest and like, wow, you know, I can read all these new research articles and everything. This is amazing. So I just love that you have the resources that you do. So I worked at PMI as adjunct faculty like in 2011, did clinicals, did a lot of teaching as a nurse, right? We're always teaching. And then came on full-time here in 2015. I did a little stint at the children's clinics. I don't know if anybody knows what that is, but it's kind of a medical home model for kids that have a CRS qualifying diagnosis, like a birth genetic kind of disorders there. But I really wanted more bedside or education, and they put me in management. I don't like management. So I came on full-time in 2015 and been teaching ever since. In 2018, I was diagnosed with Parkinson's disease. So if you see me in person, you may notice I have a pretty dominant right hand tremor. Sometimes my voice gets soft. And sometimes I struggle to kind of come up with the word I'm thinking of. Those, there's another whole host of symptoms that you get and things that you have to deal with not having enough dopamine. So by the time you develop tremor, they say something like 60 to 80% of your dopamine cells have died. So bear with me, right? And remember that number one, I'm in constant pain. And number two, so if I get a little grumpy or anything, and I can have a flat, you can get like, I forget, see here, there's a word for it, like, mask face. You can have like, not be very expressive. And sometimes people say something to me like, oh, what's that look on your face? And I wonder, what is the look on my face, you know? Or maybe I'm just am upset, you know, but yeah. So what I ask of you is, if my voice is soft, and maybe this is a little more applicable to the classroom, you know, so don't let my tremor or any of that distract you from learning. Okay, that's the main thing. And if my voice does get soft, tell me and I'll speak up. And it might just be changing the volume on my computer. So you can read my bio. I do have 2 children. I do have a partner, Tom White, right? And I've been a nurse for a long time. And, you know, I've taught a lot of clinical in the adult world too. I like to say, because there's truth in this, okay? Adults are not, like, kids are not little adults, right? You can't treat a child like you can treat an adult. But adults are big kids, right? So developmentally, we go through those stages, you know, all that growth and development. So, sorry, phone is going off. Stop. Okay, so I'd like you to know that, like, in terms of the adult world and everything, I do have experience with that also. It's not just all peds, and what I have to bring in peds, you can always apply to adults. That's the takeaway. So now you, okay? I mean, I'm not going to take like up the whole class time asking why you became a nurse, but I do have an assignment, like a Blackboard discussion group assignment, so you can always include, you know, things that you want me to know about yourself in there. But maybe I'll just start with Alexandria. So why did you become a nurse?
I wanted to be a nurse because I really like taking care of people and giving back, and making people feel better about themselves. I was a hairstylist, or still am licensed hairstylist, and I've had the opportunity to do some things for some clients that maybe they couldn't afford and stuff, and just being able to help them like regain confidence and stuff like that is just so rewarding. And so I kind of wanted to do something similar, but something that has a little more avenues, not just like one spot. And so I really like that about the nursing field.
Okay, very good. I'm making a note on your picture. Your hair's lighter now and you have glasses. This doesn't. So have you had people wanting, like saying, can I have some long layers maybe, right? This COVID hair. I don't know what to do.
Yeah, I'm going to have a lot of work to do when I get back to it.
So are you still working?
Yes, I'm licensed in California. So I normally, before COVID, I was flying back once every 4 weeks just for 2 days. And now it's been about every 8 weeks, and definitely around my school schedule. But I have 10 years of clients, so they're very understanding, and my cheerleading squad, so they're easy to work with.
Wow, so you've been a hairstylist for 10 years? No way, you are too young to have been a hairstylist for 10 years.
I started when I was 19, so.
Very good. Well, I am so glad I asked that. Let's do another. Hey, Morgan Stump. So I know some Stumps. That's kind of an unusual last name. So do you know the guy who he moved to Saipan to be Attorney General there in Saipan? Are you any relation to him?
I don't think so. I don't
Okay.
know if that's just a coincidence or not. But my father-in-law used to work at TMC, and he was like the head of endocrinology there. So you might know him, or used to know him. He's passed away. But I chose nursing because I've always been like a caregiver, and my brother, when he was really young, had a lot of medical issues. He had muscular dystrophy and would have a ton of neuropathy issues and seizures and things like that. And so he actually had like a 7-minute grand mal seizure, and I was like in the room with him as they're trying to bring him back, and it was like really intense. And after that, I just kind of saw how the medical profession was, and like how kind everyone was to me, and like keeping me calm and explaining what was happening and what they were doing. And so after that, I really wanted to become in the medical profession. I was between getting my doctoral degree and a nurse, but I am definitely more of a caregiver, and so I chose nursing.
Where was he hospitalized? Was he at TMC?
So we were actually in Phoenix at the time. So we were at Mercy Gilbert, I believe was the hospital.
Mm-hmm.
But this was when I was like 7 and he was 5, and so he was really young, but it just kind of stuck with me ever since.
Okay, and was your dad's name Dr. Stump?
So my father-in-law, his name is Dr. Stump. Mm-hmm.
Okay, that makes sense. Yes, and he's the one who was the head of endocrinology.
Mm-hmm. Correct.
Yeah, I don't know him. I haven't like really worked with him, but maybe that's where the pediatrics, right? Because like Dr. Wheeler and Dr. Leitner was, and Dr. Insel.
Yeah.
I've got a Dr. Insel story sometime, in Leitner's story.
Yeah, and he passed away actually last year, so you might not hear him or see him around because he's not there anymore.
Unless he comes to visit me now, right?
Yeah.
Okay, another good story, and that is, a lot of times I feel like people who have family members who have had a health condition, they get that calling, right? You feel that? Yeah, so good. Rachel Rosh, do I say it Rosh?
It's rash, like a skin
Rash.
rash.
Okay.
Nursing. My mom died of cancer when I was 10, and she had like a colostomy bag and suprapubic catheter, and there was like all of these tubes and things going into her and coming out of her, and I was like kind of afraid to touch her, but super interested, like whenever the nurse would come and take care of her and stuff. And I just have always been like, whenever the body is gross or people are like pooping or puking, I kind of like run towards it instead of away. And those things just don't bother me. And I like to help people like when they're at their worst and get them better and healed. Yep.
The calling, right? Nice. How about Isela? Is that how I say it? Guerrero? Isla?
Yeah, it's Isela.
Isela.
Yeah, so I was an MA for a while, for like 3 or 4 years, and I kind of tapped out. I worked at the cancer center. We did radiation. So I kind of just like wasn't able to do anything else. And I kind of want to go to chemo and do IVs and stuff, but you have to be licensed. So that's why I just decided to further my education.
Mm-hmm. So you are interested in that whole cancer area though?
Yeah, just because radiation is not so much hands-on, it's more like wound care, skin care, and more like an emotional side, versus the chemo side would be more like I said, more like medical, medicine administration, IVs, and more caring for the patient as opposed to radiation was. But I didn't have the licensing to be able to go.
Mm-hmm. Okay. Let's see. Brittany Kiros.
So nursing for me was kind of just a career change in a sense. So I'm in the Air National Guard, and I am an aircraft electrician. And after I had my son, I was kind of not wanting to do that job anymore. And being in labor and delivery, it kind of like sparked my interest. I was like, oh, I could probably do a labor and delivery nurse. So got to talking like with my husband, and then my sister-in-law is she was a labor and delivery nurse, and now she's in the GI lab. But got to talking with him and her, and then we kind of just made the move, and I started applying for nursing school, and here I am now.
And you have the one daughter?
I have a stepdaughter. I have a 4-year-old stepdaughter, but I have a 10-month-old son. I just had him in November.
So you're busy.
Yeah, just a little bit. And he doesn't sleep through the night, so that's another issue that we're trying to fight. But busy as I'll ever be, I guess.
What's that?
It's busy as I'll ever be right now.
Yeah. Okay, let's see. Who else can I pick on? Selena Paco? Is it Selena?
It's Selena, yeah. So I decided to do nursing because I was the medical assistant for 12 years. So just like Isela said, you cap out. There's only certain things you can do as a medical assistant, and I just want to go into more of the hospital setting than rather than a clinical and our clinic. So that's why I chose nursing.
Mm-hmm. I think you made a really good choice. In nursing, I didn't ever feel like I capped out, right? It wasn't a matter of like getting bored, even just on pediatrics, right? Floating into the PICU. It was not burning out, right? It was having that balance in your life, and things changed. There was always something new to learn, So I think in nursing, you're never going to feel that. There's so many different areas. There's so many different, places you can go with a nursing degree. So even this semester, like how many of you, did you start clinical yet? Or you start clinical this week, right? Yeah, because you go to clinical on Monday, right? Yeah. So like half the class is starting on Monday? This coming Monday?
It's more like a handful of us because there's only one location. So it's only like, I don't know, like 6 or 7 in the group, I think. The rest of us it depends on what group you're in, and then if you're doing VSIM this coming week or not.
Okay, so is there 8 in the group? Or 7? I can look at it.
Something like that. I don't really remember the groups.
But so do you get 3 weeks of how many weeks of real clinical? In-person clinical?
Yeah, it's 3 weeks.
Yeah.
And then 5 VSIMs. But just based on the groups, like everybody's kind of in a different group.
So one time I went to a long-term care. I've been to different long-term cares with second semester, and they've all been really, really good. And then I went to one long-term care, and I won't name which one it was. And I think it was just a communication thing, but they had other students there from a different program. And they basically like gave them all the vitals and gave them all the, showers and stuff. And it was, I needed to like step in and say, these are nursing students and they're going to take a patient, they're going to do this, and it reminded me of like when I first started in nursing school, like my very first day of clinical, I walked into a long-term care and the nurses were kind of laughing and they're like, oh, this guy's going to have his every 3-day enema. And good, he's got a student, and this was a very large man, and they had me in there, and he had a spasticity, and so he was very difficult to move and clean up and everything, and I was all by myself, and I was young, and then after that clinical, I had to go back to campus, and we had an evening class, and I had to take a test, and I remember sitting there after the test and turning to my friend Dana and saying, do I smell like poop? Because I feel like I smell like poop, and she's like, no, you smell like soap. Like, because I still feel like I have this smell up in my nose. And I just remember them, like that very first day of clinical, like them laughing that they were going to give me this, this skill to do, and letting, like they used to say, like nurses eat their young. I don't know if you've heard that, and I think sometimes, long-term care, for different situations, you might see patients that are kind of scary. You might like see a level of care that after you've been taught in first semester, this is how we treat people, this is how we talk to people, this is how you're holistic, right? And then you might not see that level of care there. And so you might feel that kind of that ethical angst. Here's my message, okay? There's so many different areas of nursing. You get called to long-term care, good. Work in that area, change it, make it a good place, make it you can change that work ethic on your unit, right? Especially as a new grad coming in and changing things up, right? Yeah, or you'll find an area that you're really called to work in that's right for you. So when you go to long-term care this semester, if it's not what you would want to do every day in your life, don't even think about quitting nursing. Of course you wouldn't, but in case something happens, right? Or in case it's not what you thought it would be, hang in there, because more different roles in different areas are coming, right? Does that make sense? So, yeah. Okay. So I don't think you're ever going to cap. I think that's interesting that you wanted, we talk about being a lifelong learner, right? Do you feel that that's true, Selena, that, did you feel that like as you were working in that role as an MA and?
Yeah.
And so what area, do you know what area of nursing that you're interested in?
Well, I worked OBGYN for like 8 years. And then I did urology for the other few. So
I was really waiting for you to say long-term care, right? And I
no,
like
I don't want to do long-term care,
right? Long-term care can be very rewarding. So, but yeah. So you're thinking one of those like med surg, like going back to labor and delivery or mom baby or
Maybe labor and delivery, yeah.
maybe. Very good.
Maybe.
Uh-huh. Yeah, and you know, there's students that work in long-term care too, and during this whole COVID thing, it's been really amazing. You know, I really respect you know, all of you, anybody who's working on the front line during this time, of course, right? So I think especially long-term care it's been a challenge. Okay, so let's talk about this course a little bit more. Anybody else like, really, Ms. Erickson, I was hoping you'd call on me. I wanted to share why I want to be a nurse. I mean, all these things are good, right? You felt that calling, you had something in your life that drew you to nursing, you want to help people, you want to take care of people, right? So how do we do that? So that's why I'm here, to help you be the best possible nurse you can be. Remember
why I chose to become a nurse.
Yeah.
And so my mom was going through a lot of health issues when I was younger. And I remember, I grew up in Arkansas, so we like very mildly diverse. There wasn't a lot of people that looked like me or spoke the language that I speak, which is Spanish. So I remember just having a pretty bad experience with like nurses and doctors putting us off because there weren't a lot of interpreters back then. So I was used as my mom's interpreter a lot of the times, which, you know, nurses and doctors and all those people, they didn't really take us seriously, or my mom's health seriously. So, but then I also saw like really good nurses and really good doctors. So I just kind of like decided I want to be someone who makes a difference and actually like treat someone how you would want to be treated. And so, and just bring my Spanish speaking and cultural background, you know, benefiting a lot of people.
Yeah, Esme, I remember you telling me this before. Yeah.
Because I feel like a lot of people like think, oh, nurses are so caring, and which, you know, that's what we're supposed to be, caring and like, you know, giving, but there's a lot of times where it's not always the case. So.
Right, and that's one of the cardinal rules, isn't it? When you get into nursing and they teach you, you're supposed to use, you know, a interpreter, a medically, you know, trained person who's tested and can, you know, as a medical interpreter, use our Seracom phones at the bedside. Because
that's changed so much since back then, but like, yeah, I mean, I was really young when I was going through all this. So when my mom was going through all this, so a lot of things have changed, but yep. And I also was a medical assistant for 5-6 years. So, and just like Selena said, it's just, there's only so much you can do and like so much you can benefit from it. So.
Right.
Yeah.
And, you know, I really see when somebody with, you know, medical assistant background or other medical background comes into the nursing program, you know, or mothers, teachers, other professions, hairdressers, hairstylists, you know, if you're good with hair, hey, you know how many nurses are going to be asking you to come in and you know, fix their patient's hair for them, right? You're going to have boundaries with that. So you use all your knowledge in your life that you've had up until this point, you're going to transfer it into being a nurse. You're going to use it. You know, it can apply to taking care of people. But you're also going to have to look at, are there things I've been taught where now as a nurse, I'm going to approach it differently? Sterile technique, you know, it's very specific. So, you know, you want to make sure that you learned things right and that, you know, you're not like just assuming that you know it because you were trained, you know, you were approaching it as a MA. You know, maybe there's a little bit more in terms of nursing assessment and thought that needs to go into it too. So be open to learning it as a nurse, but take everything that you know and apply it, right? So there's the best of both worlds there. We always want to be open, right, to learning. So yeah, anybody else before I move on? Anybody else want to share? Because that's a great example, Esme, and really speaks to my heart too, because I feel for you. You know, that was a hard childhood, hard experience. I myself had a father who, his name was Clyde, and I'll tell you, there's nobody else out there like him. Except maybe my partner, actually. When he parked his car, he pulled up, he parked his car, and he threw his car keys under the front seat of the driver's side. And I said, what did you just do? And he goes, oh, I hate looking for my keys. I'm not going to lock my door. I'm just going to, we're just going to run in, because if anybody wants to steal my car, they can have it. I don't want to look for my keys. I'm like, there's just one other man in my life that I know who has ever just thrown his car keys under the driver's side of his seat. My dad, and that's when I knew I was in trouble, right? But my dad had really severe asthma and allergies as a newborn, and my grandmother had to buy a goat. I think she was just a nurse at heart. She was a farmer, and my grandfather and her owned a real estate company and did a lot of development in our area. But she really nursed my dad and saved his life. And he had all kinds of health problems as I grew up. He would get very sick in the winters. He sold real estate, so then a lot of times, there were money issues because of his chronic health. And he would fall and cut his leg, and he would stitch it up himself and take out his own stitches, and he once he was in the hospital and had a nasogastric tube and pulled it out in the middle of the night, and he didn't want the nurse to know, so he put down his own NG. He put it back down himself. So he was just a character of a guy. And he would come out, when I moved to Arizona, he would come out here and stay out in my property in a pop-up camper and go down to Mexico and get high-dose steroids to treat his asthma. And so then as a nurse, trying to tell him the side effects, the adverse side effects of high-dose steroids, and having him say, yeah, but you don't know what it's like not to be able to breathe. And going to the hospital and talking to the pulmonary doctors and them saying, Penny, he may have a point. Maybe he does really need that much steroid. We wouldn't prescribe that here, but he's making his own choices, right? So he passed away at age 70 years ago, but I'm sure that influenced me growing up, having all of his, health problems in the home. So, so anyway, here we are, we're online, right? And so this is our hybrid model. We're going to be having class synchronous, when every Tuesday, 2 to 5, I want to be online live. I like it better than doing taped lectures. If you've had other experiences with instructors taping lectures and you watch the lecture and then you come to class time and you're discussing it and taking it further, we can do that too, okay? I don't want to overwhelm you though with having to watch a big long lecture and then coming to class and, or a lot of discussion boards on top of everything else. So, but communicate to me, okay? So I'll plan on doing lecture live and having questions and answers and that kind of thing built into it, unless there's other things that you want us to try, okay? Next week, I'm going to do like a breakout session. Have you done breakout rooms with your instructors and gone into like the little teams? The 3 students that have had me before, when we did that with the cultural needs assessment and stuff. So, we'll go in there again and look at Lippincott and that. Doing Kahoots and maybe Quizlets and doing lecture using Prezi. Have you ever seen like the Prezi? It's kind of conceptual with these little burst out clouds and stuff. And so just kind of using some different delivery methods, even though we're doing Zoom. It is a 7-hour credit course. So we have 208 hours, right? So 16 times 3, that's our class. Our theory is 48 hours. Then you have clinical for 96 hours and 64 hours of lab, right? In lab, you're going to have your 3 simulations that connect really well to the different concepts that we're learning. So, Ms. Arnold's teaching your lab. She's going to be, lab's going to be 9% of your grade overall. So, so in this class though, 21 hours a week, right? So sit down. Have you done this, you know, with like your professional nursing class that you had? What was it, Nursing 109, right? First semester, where you kind of looked at time management and study habits and that kind of thing. Did you do that? Yes. And so, you know, when you look at your classes and all the readings and all the outside hours, try to kind of look at how you're going to schedule that out, right? What days are you going to take and are going to be your school days? Because we're going to be doing a lot of prep use. There's a lot of reading in this class. There's other outside team assignments, which you get points for. So that can really make, you know, help out your grade to work in those team assignments. So just know that there's that 21 hours of outside work that, you know, it's not me. You know, I think sometimes students are like, well, Ms. Erickson, why do you give so much work, right? They don't really say that a lot about me. But, or, you know, why is there so much reading? Or what do you expect about this assignment? Well, it's not just me, right? It's the course curriculum and looking at these hour requirements as a contract between PMI and the Board of Nursing. So these are required elements of the course curriculum. So I'm trying not to take it too personally as being the mean person who gives you all this work, right? I'm giving you all this opportunity to learn. We'll be more positive about it. Okay. Okay, so here's our required textbooks. The Fundamentals of Nursing book is the 9th edition. And then we have our Medical Surgical Nursing book, and the Nursing Skills book is your lab book. You also have the Medical Terminology book, right? You know this one? That you see online? I like it also because have you ever gone in here and played the games and stuff, like the robo terms and concentration games? Have you ever done that? So at some point today, I do want to take some time to show you some of those resources in the point, okay? Because that will really help your learning. Have you also gone into Kaplan and watched any of the videos in there? And have you made your own practice quizzes in there also? So there's ways of setting up your own practice quizzes in your own topics. So, you know, we also have the PMI library, DocuCare, the point, and other, right, resources for your learning. Course description, I highlighted some keywords, right? So we're going to broaden your novice understanding, evidence-based health promotion and maintenance through a foundational platform of knowledge, skills, and attitudes. So one of your assignments for this week was to go in, you need to go in and kind of review the student handbook, right? Look at the philosophy of the PMI nursing program, you know, to prepare you as a 21st century new grad nurse, a novice nurse, you know, so that you're able to go out there and function safely in this healthcare environment, okay? So, and we'll talk about those, you know, the professionalism and some of these concepts of the knowledge, skills, and attitudes are cues and competencies. I don't want you to just have the knowledge of the content, right? You need to kinesthetically perform the skill, the dressing change. And you need to have this professional, caring attitude. So, you know, when we're communicating, when we're emailing each other, all those, when we're talking to each other, we're going to be caring like that. We're going to always have that kind of attitude, not just with me too, with each other. When you're working in your teams, who here loves teamwork? Anybody here was like, yay, yeah, okay, Alexandria, right? Give me a team assignment. Do you like to be the leader too? Are you like, I'll be, yeah, I'll get, yeah, more, okay. Done your fair share? So, yeah, but you know, teamwork isn't going away because teamwork's the one thing that's going to prepare you for nursing too, right? You cannot function alone in a healthcare setting as a nurse. You have to collaborate, right? If you collaborate with the person first, and the physician, and you know, then the other healthcare professionals. So I don't think there's area of nursing where you're not collaborating with someone. So having those, you know, the right attitude. And I used to think that was something I couldn't teach, and now I've realized it is. It's something we teach all the time. So foundational concepts regarding the nurse's role and nursing process are emphasized. You know all about, right, ADPI. We have to assess first. There's always more to the story, right? So we keep assessing. And then identifying those issues, the nursing diagnosis, implementing our interventions, seeing if we've met our goal, and then reevaluating and changing our plan of care. It's this ongoing process with this care planning. You know, nurses, I know a lot of times students think, you know, when I get out there as a nurse, I'm not going to be sitting there writing out these nursing diagnosis and this plan of care. And a lot of times, you know, that's correct. We don't do it. We have to have it on the chart for the regulating organizations to accredit the organization. But nurses think this constantly, right? They're always identifying the assessment, what's going on. We were in PICU on Friday, and this newly diagnosed person with diabetes came in, new diagnosis of diabetes. She walks in with her mother. The PICU nurse says to me under her breath, well, she's not in DKA. I turn to the student and say, that's a doorway, what we like to call a doorway assessment. How does the PICU nurse know that that patient's not in DKA? And the student looked at me and said, because the patient's alert and oriented, she's walking, she's not breathing fast, she's not pale and sweaty. And I went, yay, right? I'm like, yes, amazing, that's great, you know, right? Yeah. So, you know, she wasn't, and the student didn't need to sit there and write out, you know, alteration in metabolic process related to lack of insulin is evidenced by, right? She could identify, we think that way, we think nursing process. So we're gonna look at these foundational concepts, nurse's role, nursing process emphasized, target health altering events identified by various healthcare databases, subsequent patient care needs encountered across the lifespan that influence wellness, illness state. Focus on, here are our main concepts. Oxygenation, that's a concept, right? How does respiration, gas exchange, and ventilation occur? Cardiac output, tissue perfusion, digestion, elimination, and skin integrity. In terms of chunking the content of this course, okay, that's how we're going to move through each section. Oxygenation, cardiac output, tissue perfusion, digestion, elimination, and skin integrity. So now focusing on those concepts, you can go back, you can look at the course outline and see how that outline uses these concepts and nursing process. So we'll look at those concepts. We'll have examples of certain pathos that are perfect. You know, an exemplar is an example, right? So patient pathophysiology, that is that concept applied to that person. So key concepts are correlated with your sim lab. So when we go to oxygenation, we're going to have like a pneumonia sim or something like that. Cardiac output, we might have like a stable angina sim. Tissue perfusion, digestion, elimination, we might have like a new type 2 diabetes or fluid electrolyte imbalance, something like that. Skin integrity, right? So that last sim might have a wound or something like that too. Okay, and then your clinical practice in your different settings. Okay, so I'll finish up the course format and stuff and kind of introducing the course. Let's take a quick break and come back at 3:18, okay? So go ahead, get up, stretch, use the restroom, get a drink, come back 3:18. Okay, it's 3:18. I can't see everybody back yet. Trevor, Mariah, Zeta. There you guys are. Hello. Okay, so where were we? So this course format, right? So combination of Zoom lecture, unless we get the vaccine and they're like, okay, everybody, you can go back to campus. It's all safe now, right? I don't think that's happening this semester. So we're going to plan on being online for class. But you know, even though we say online, this is not like a regular online course. I'm sure you can agree. You know, those of you who have taken online courses, a lot of the times they're kind of almost like a self-study, right? They're kind of just facilitated by the instructor. I want you to feel like here we are, we could be sitting in the classroom, right? I know that you have distractions at home, and it takes a little bit more to feel engaged here, right? To feel like we're all in this, you know, class together. But if you were in the classroom, you know that there's distractions there also, right? Somebody's fidgeting next to you, somebody's on their laptop typing away on something. You know, if they're taking notes, great, right? But that's still a distraction. Maybe they are sniffling or sneezing, right? So that's all going around you in the classroom also. So you have pros and cons on either format. We save a little time. We're not having to drive into campus, right? So that's kind of nice. But I want you here with the mentality, just like you're in the class, right? You're engaged, you're attending, you're dressed and looking professional, right? You don't have to be in your uniform, you know, but we don't want you eating or drinking on screen anymore. Did you go over netiquette with any of your other instructors? Are you familiar with that new term that we're using? Who's heard of netiquette? I was like, what is this, right? I'm going to come up with a new thing. You know how we talk about the rights with medication administration, right? The right patient, the right route. How about netiquette? Explaining to your patient what their medications are and the risks and the side effects, right? That's netiquette. That's what, you know, we do when we're practicing those social skills giving medicine. I will have to come up with other etiquette kind of things that we could do the play on words. I think that's funny. So come to class with those practicing the knowledge, right? You're going to come to class and you've read the material, you understand, you have all the answers. The skills and the attitude, you're going to have that attitude of that professional nurse when you come to my course, okay? Somebody asked me, why can't we eat on camera? Like, have you seen some of you eat on camera? It's distracting. So I know that it's a little different in the classroom. You know, we have allergies and, you know, those kind of concerns also that we don't have online. But we'll take breaks, okay? And then you can always get something to eat on break. I'm okay with you drinking water, of course. You know, you can drink, but the eating thing, it can be distracting. And they do want you on camera, so I can see that you're in class. If you're here and you've signed in, you should attend class in the entirety. If for some reason you're going to be off, you know, doing something, you need to inform myself and Ms. Severson why you're going to be absent before class. Okay, something comes up, you private message me, let me know something's come up, and then you email me and Ms. Severson afterward, you know, with be honest about your class time that you're attending. It's really important. You know, we're looking for that professional integrity in you that we'll expect to see as a professional nurse. So this course is going to provide you with, you know, the opportunity to apply your skills that you're learning in the classroom and in the lab, within the simulated environment, and then in clinical also. So your outside hours are based on the average time for a student to complete the work. So, you know, I look at how much your clinical paperwork takes, how much reading you're doing in lab, and like ticket-ins for lab, and team assignments that I give you here, your prep use in your reading, how many pages of reading I'm giving you each week. And, you know, it takes me about an hour to go through a 30-page chapter, right? About an hour a chapter. So that's kind of how I look at that. And I can look at how many minutes that you're spending on the prep use. You know, if you're doing it over days where you start it and then you're taking breaks in between, sometimes, you know, I don't get as accurate of a number on the minutes. So that's when I kind of will check in and see how much time you're taking. You know, I see a direct correlation between how many prep use and quizzes students are doing and their grades in the classroom. It's amazing. I think that really reinforces your learning. So the more prep use, the better. So preparing projects, writing papers, practicing skills, practicing your lab skills. Open Lab is going to be available, and conducting additional research, right? Getting in there into that PMI library, getting into the concept library. There's some good articles under the concepts. And under, you know how they'll have like the concept, and then to the right, they have the different exemplars related to that concept, and you click on the exemplar and then you'll get more research articles and things related to that exemplar, the specific. So you're required to be in attendance, participate, right? One way that I like to hold team members accountable is to put your name like on your PowerPoint slides that you're contributing, so that I can see who's doing what work. And then if we're presenting in class, then you know, I can pull up that slide and you can present on the slide that's yours, so that we know that everybody's involved. So, you know, we want you to work productively in teams and groups like you're going to as a professional nurse. Achieve that 77% grade average. And if you score less than 80% on an exam, email me, remediate with me. I like to give you specific feedback on what areas of content you missed questions on, so that you know what you can go back and study. So I'd like to think that, you know, that time is used efficiently and it's useful for the student. Complete the course in its entirety with a passing grade. See, I told you my goal is your goal, right? I bet your goal is to take this course and receive a passing grade, right? Is that everybody's, yeah, your goal? Okay. My goal for you also, okay? Remind me, I like to tell you before every exam that I am perfectly okay with you acing that exam, okay? I will be fine with it. I won't be like upset that I made the exam too easy. I'll be glad that you all got an A, so go for it, okay? Don't feel like, you know, like I'll be concerned if y'all get A's. I'm still waiting for that, okay? So you be the class. How about that? Complete the course in the entirety with a passing grade. If you fail, you'll be required to repeat the course, blah, blah, blah. And attendance, of course, right? 5, 10, 15%. Don't miss 14 days consecutively, right? So we track your attendance. You need to go into Blackboard. Did everybody go into Blackboard and click on the attendance assignment and say that you were ready to attend the course? Okay, that is how Ms. Severson is going to be tracking your attendance each week. If you don't go in there and do that, she's going to count you absent. You're not going to get credit for your minutes for attending class. So make sure you're putting a little sticky note on your computer, right? So that before you log into my Zoom meeting, you are going into Blackboard and signing into attendance, okay? So, and this also requires, it also addresses emailing us prior to being absent. Really important that you communicate that to us and email us. Okay. Any questions about attendance? Unfortunately, perfect attendance awards, according to the syllabus, it says it's only for on-ground students. So if that's something that you want to achieve, talk to Ms. Wiebelhaus about that. I don't know too many students that get through the nursing program with perfect attendance. Something always comes up. Okay, so you know, if you're absent more than 15% of the class or 14 straight days, that's grounds for termination also. You've missed too much. And it's really important you attend all your clinical hours. So if you do miss clinical, Ms. Edwards will have a makeup for you. If you miss too much clinical that she's not able to do makeups, then you're in jeopardy also of not being successful. And I'm sure your instructors for clinical are going to go over that expectation too, that when you're in simulated clinical, you know, if you're in a virtual clinical, you're still required to be available that whole day as if you were in clinical. Treat it like a real clinical day, if you're absent for an exam, unless it's birth, death, or, you know, something like that, you won't be excused and you'll get a 10% deduction off of your exam. So be here, set your alarms, right? Remind each other, don't miss exams, because that's a hard hit, right? 10%. Nobody wants to get 10% off an exam. Okay. Also, your lab skills, even though they're ungraded, you know, you get it's the 3 strikes and you're out rule, right? So I like to say, you know, come in that first time and be prepared and be able to pass your skill on the first time, because none of us wants more work, right? And when you get behind and you're having to go back and remediate a skill, and then you're nervous because you've not done it successfully once, you know, it increases the stress. So when you know there's a checkoff, be prepared, bring your skills checkoff card and go through, memorize that whole skill, watch those videos, practice the skill at home, and come in and do it. And then once you're checked off on it, don't think one and done, right? Continue to practice and review that skill. And if you at any time feel like you're getting a little rusty on it, that's when you come into open lab and you practice it. And you make sure that if you're ever in the situation where you're able to do that in clinical, that you feel comfortable and ready to perform it. Okay? So remember, only you know how you feel about your skills. So only you know what to sign up for open lab for, and, you know, email that instructor that's assigned to that open lab, bring that skill in, ask your questions, and make sure that you're really, you know, efficient and feel confident and competent in that skill, right? It's not just practice, it's perfect practice makes perfect. And campus facilities are still open, yay, right? For skills lab, for small groups, we're gonna continue to do lab on campus, except for the didactic part, the skills part, right? So here's the breakdown of my contract with you in terms of grading. Tests are gonna be worth 40%. Right now, if you look at that quick view outline, we have 4 tests scheduled. I don't break it down. I don't state in the syllabus that tests are 10% each, because that's not the contract, okay? You guys as a class, not that you'll do this, right? Because we don't want more work. But let's say you do poorly on a test overall. I could always throw in another test, okay? I have that ability because I've just said tests are 40%, okay? So that's why it's like that. But my plan in the back of my, you know, plan A is 4 exams, 40%. And then what I like to do is give a quiz before each test to help you kind of get familiar with the types of questions that you're going to see on the exam. A lot of times I'll take questions like from the end of the chapter. Usually in your reading at the end, there's some really good questions in there. And I can take kind of that content and those types of questions and change them up and stuff and make a quiz out of it, something like that. Or some of the prep you questions, you know, that I thought were good, I can kind of, you know, make up a similar question to that. So what I'm saying is those prep you questions and reviewing the end of the chapter will help prepare you for quizzes. And then I do give study guides too that usually are very helpful in trying to focus what you know, what we're reviewing. It's really basically just the chapter outlined, but it does, you know, help, I think, students be successful in preparing a really good study guide for the exam. And then we're going to have 9 outside assignments, so you'll get 9% for that. PPS, right? So if you miss a discussion board, or you forget to email me and you're absent for class, or, you know, all those things that, you know, you lose PPS points for, you know, if you get 5%, so you start out right now, you got those 5 points, right? You got 100%. Everybody starts out with A's in PPS. But when you get 5% deduction, you lose it in every class. Did you know that? So then you're at a 95 in every class, and then a 90, you know, so you know, that can make a difference in your grade. So, you know, remember, you know, keep track of when things are announced in class, and I'll send out reminders in Blackboard, you know, near the end of the week, so that, you know, if we're having class on Tuesday, by Friday, you know, it's easy to forget, okay, what do I have to do this weekend to prepare for class on Tuesday? I'll send out a reminder email, okay? But like the assignment for next week, the initial post is, we're going to do a discussion board, and the initial post is due like Thursday end of day or something like that. So, if I'm emailing you on Friday, I guess I'll have to do it earlier Thursday and say, hey, get okay. Anyway, lab, if, like I said, according to plan, right, if we do 3 sims, they'll be 3% each, but lab in total is 9%. So it gives us some freedom. And then clinical is 10%. We're going to have 2, they may be Kaplans, but again, I'm being general with the wording because if, for some reason COVID-19 changes access to Kaplan tests, or we can't go on campus to do, proctored exams, I could do an alternative comprehensive exam. There'll be 2 of them. One will be kind of a health assessment, and the other will be a fundamentals. And then the finals worth 15%. Okay. Any questions on the grading or the breakdown or anything related to the syllabus of the course so far? Okay. And then the course objectives, right? Like I said, identifying health promotion and health maintenance practices, right? Diverse populations, holistic care, therapeutic communication, looking at those culturally competent care, and incorporating those nursing interventions into the care of assigned patients with common health alterations. So, promoting health and health maintenance in that population, utilizing nursing process, ADPI, right? Assessing interdisciplinary collaboration and collaborative nursing interventions, demonstrating nursing process, holistic patient-centered care across the lifespan in our concepts: oxygenation, ventilation, gas exchange, circulation, cardiac output. So they separated out in our course outline as central perfusion and local perfusion. But I think that's interesting because I've never heard it called local perfusion. I've always heard it called peripheral perfusion. But they use in our course outline, they use local perfusion. Digestion, nutrition, and metabolism, and elimination, and skin integrity. And then they list out the different lab skills that you're going to learn also: colostomy care, wound care, and suture and stapling, glucose monitoring, postmortem care, INO, therapeutic communication, O2 delivery devices, incentive spirometer, Foley insertion and care, phlebotomy, NG tube insertion, trach care, nasal tracheal bronchial suctioning, and enema administration. Okay? So looking at those concepts, we're going to start out week 4. So here we are. We're going to kind of chunk our semester out, okay? So here we are week 1. Next week, we're going to learn about culturally competent care. And then week 3, we're going to have exam 1. So week 2, I'll have the study guide come out, and then we'll have our exam 1, which is kind of a review, right? Health promotion levels and that kind of thing is kind of you agree that's kind of review from first semester? You learned about that last semester, okay? And introduction to healthcare. So, and then week 4, we move into oxygenation. So 4 main exemplars for oxygenation is our chronic obstructive pulmonary disease, reactive airway disease, or asthma. Okay, we like to say reactive airway disease because it gives us a picture of what's going on in that patho. Mariah, who are you looking at? Is somebody off camera over there?
My dad just let the dog in.
All right, Dad. I needed to know what was up. I'm like, okay, pneumonia, right? And TB, tuberculosis. So I like these acronyms, right? We got our COPD, our RAD, our PNA, and our TB, right? And then we're going to move on to circulation and cardiac output. And the exemplars that we're going to focus on are the angina and the heart failure. And we're going to talk about what right-sided heart failure looks like versus left-sided heart failure. With angina, we're also going to look at some of the cardiac arrhythmias, right? We're going to break that down and look at just some of the basics. And the tissue perfusion, you know, what are some of those exemplars in terms of, is it peripheral arterial disease or peripheral vascular? That's easy for me to say, right? Is it the veins? Is it the vascular disease, or is it the arterial disease? And then is it atherosclerosis? What's the good cholesterol and the bad cholesterol? Hypertension, myocardial infarction, and then a coronary artery disease, hyperlipidemia, right? And of course, you know, smoking being the #1 risk factor. So with nutrition, digestion, and elimination, we're going to be looking at malnutrition, right? So there's the two ends of the spectrum. There's, you know, the eating disorders and the less than body requirements, the nutritional deficits, and then there's obesity is also, even though you're overweight, you still don't have the nutrients you need also. And then irritable bowel disease, we'll look at Crohn's versus ulcerative colitis. We're going to look at constipation, incontinence, urinary tract infections. And then metabolism, the big one we're focusing on is diabetes. Okay, your type 1 and your type 2 diabetes and differences between them. And then we'll finish up with skin integrity and pressure ulcers, wounds, and cellulitis. So I said there's going to be a quiz that I'm planning to have a quiz before each of the exams. So I'll have a quiz before oxygenation and a quiz before cardiac output exam. And then I'll have a quiz before the nutrition, digestion, elimination, and metabolism. At the end, with skin integrity and wound healing, we'll have a quiz, and then we'll take the final. Okay, there's not a, so there's not going to be a quiz before exam 1, because exam 1's kind of, I look at that as kind of being review. Okay, I'm not going to say exam 1's easy, because I want to make sure you're all studying really well and doing well on the first exam. So I asked you, why did you go into nursing, right? And you heard these answers that really come out of kind of your view of life, right? And what you wanted to do. And, you know, so you looked at the value of helping others, right? You looked at how you perceived life from going through, you know, with your family member, somebody that you loved, that you saw this interaction, or, you know, where you could make a difference. So looking at just how we view life, and, you know, wanting to have that study of wisdom, that fundamental knowledge, processes to develop and construct your perception of life, right? What is that meaning of life? How are we viewing life? You know, philosophy provides a viewpoint and implies a system of values and beliefs. Each individual develops a personal philosophy to give meaning to experiences and to guide behavior and attitudes. So the type of nurse you're going to be is going to be built out of this, right? What do you value, and how, you know, what's that perception of yourself and what you have to contribute? And your personal philosophies are developed by learning from your interpersonal relationships. Hopefully we're open-minded and open-hearted, that we're continuing to learn from each other. And through formal and informal educational experiences, through religion and culture, and from the environment, from our world that's ever changing, right? So thinking about, you know, our philosophical viewpoints, right? These 3 basic concepts, this reverence for the gift of life. You know, hopefully we all have this value for life and for the human being, right? And hopefully we kind of marvel at how the human being works, you know, how we can, what we're learning about it, how there's always more and more to learn, and getting excited by the advances and things that we see, how you know, the things that we're learning, how it can benefit people and their quality of life and their life expectancy. And, you know, having that value that we want to find cures to things that's going to impact, you know, and benefit people. So respect for dignity and worth and autonomy and individuality of each human being, right? And that resolution to act dynamically in relation to one's beliefs. So and then looking at your role as a professional nurse, what does it mean? What does professionalism mean to you? Trevor, what does it mean? What is professionalism?
So professionalism to me is like acting in like a respectful manner, and not only that, but performing the duties that you're responsible for, like showing up on time, being honest, having integrity.
Very good. Yes. So I kind of look at, like, I was hearing what you were saying, and it kind of fits with this. So if you're very knowledgeable, right? You're the smartest person. You know, you have a great understanding of these medications and what they do and this whole thing. And you come into my room and you say, here's your medicines, take your medicines, right? You don't show caring. Are you a great professional nurse? If you're caring, but you don't know what you're doing, are you a good professional nurse? So you have to have kind of all aspects of it, right? You have to have that knowledge, that expertise. So, you know, if you're professional, you're going to continue. You're going to have that lifelong learner, that growth. You're going to, you know, constantly quest for more knowledge and expertise in your profession, right? Your professional growth. So you're looking at but also then that knowledge. So any nurse can go in, and, you know, anybody really can go in and help clean a patient up, right? Somebody who's incontinent. I mean, that's embarrassing. That's, you know, nobody who, you know, a human being doesn't want to be laying in a bed and be, you know, dependent on somebody else to clean them up, right? So that's hard. But the nurse who can go in there and talk to that person and interact with them and maintain their integrity as a human being and show, you know, and value their worth as the person in the bed, sharing, you know, that knowledge, like treating them as a human being, which they are, right? That person in that body, right? So the nurse who has that ability, that's the professional, right? That's how we want to interact with people. That's how we want to develop that rapport and show that caring and promote healing, right? That we do as nurses. So yeah, so I like that, you know, those professional behaviors, that commitment to secure the interest in the welfare of those entrusted to the nurse's care. These behaviors flow out of the professional values of nursing as identified by the AACN: altruism, autonomy, human dignity, integrity, and social justice, right? So we got to be careful with the social justice term these days, right? I don't want to make that political in any way, but nurses still, we do care for the rights of human beings. So in your concept library, Nita Jane Carrington made this kind of conceptual little tutorial where you can click on things, and it just shows you like the different roles and responsibilities of the nurse and everything. You know, we're coming up on our second hour already, so I'm not gonna get into that, but it's kind of fun to go into the point and review just kind of that conceptual interactive tutorial that she has. Talks about the different aspects of assessing a nursing process, the nurse as the professional using nursing process to diagnose. You know, I just think it's really interesting how when we look at the difference between physicians and nurses, right? We used to say doctors cure and nurses care, right? But nursing is so much more than that, right? Like the doctor, you know, they approach the patient, the person, and they want to figure out, like they go through all these differential diagnoses, right? And from what they know from their body of knowledge, how they can medically diagnose the patient, right? And they come up with the specific diagnosis, and based on evidence, they determine the best, you know, interventions, the medications and things that the physician orders. Or us as the nurse, you know, I'm not saying physicians don't approach the patient holistically, but using, you know, think about these concepts: oxygenation, pain, circulation, fluid and electrolyte balance, all these things. This has us, that's our body of knowledge, right? Understanding physiologically the processes of the body, the concepts, how this person, we look at this person, this human being, conceptually as the different concepts that make up that person, right? How the body functions. That's nursing's body of knowledge. And out of that, assessing those systems and those concepts is where we come up with our nursing diagnoses that actually facilitates that healing process, right? What are the issues that are going on with that person? How can I intervene and get them up walking and build up their strength and push fluids and maintain their hydration status, because we know how important is water, right? Our body needs it. How does that oxygenate the cells, right? So, in teaching that patient about how important it is to wash their hands, right? Something so simple, but so imperative, especially in this environment. How important is it to teach your family members how wearing a mask, right, can be so important, how it can prevent 100% of disease transmission in this pandemic if we wear a mask and we wash our hands and we don't touch our face and we stay 6 feet away. That's all it takes. It's a droplet, right? It doesn't have a brain. All it wants to do is spread from person to person. All we who have brains need to do is stop it from doing that. And we win. So, right? So I love to explain that learning conceptually is our professional body of knowledge. And flow, right? WWFND, baby, right? What would Florence Nightingale do? She'd say, show me the study, right? Where's the evidence? She was really the first nurse researcher. She gathered data, she analyzed the data. She looked at light and air, fresh air and clean linens and those, infection control. And she developed the first nursing programs and education and looked at nursing as a profession out of the Crimean War, right? So we kind of look at her as that first, professional nurse, along with others, who contributed to the cause. So, like I said, read through your student handbook that explains this, what is our mission and our, to improve the quality of your life. I'm going to improve the quality of your life. Do you know how many nursing students graduate? They go out there, they're working, and they are happy. They are so happy. I go out there and they're like, I love it. Just Friday, I go in, and one of our graduates, Jen, is there in pediatrics. And she's like, I love this job. And I'm like, I know, don't you love this place? Because I worked there for 30 years and, I loved it too. But that's what I want to see. I want to see people who always wanted to be a nurse, graduate, go out there, get a job, and they love it. So hopefully, that is what is in your near future. Okay, improving the quality of your life by providing the best value in medical career education to make you competent at the entry level in the 21st century. Okay, and our philosophy goes hand in hand with the mission and the vision statement also. Okay, I'm not going to read all this unless you want me to. Stop me if you want me to read it, if you don't want to just review it later. Program goals, right? That, remember, you don't need to learn it all and know it all when you graduate from nursing school. You need to pass the NCLEX, and then you're a new graduate, and then you go out there and you find the place that you're going to want to work. And good. For a moment there, nobody was moving. I was afraid you froze. It was a little bit glitchy. Okay, good. And then you pass your boards, and then you do a year of new graduate work. So you'll continue to learn for a while. One of our new grads that was working out there, she's going on 3 years. And I'm like, oh, now you're not a new grad anymore. Now you're a novice nurse. She's like, yeah, I still feel really new. Like, well, you're new for 3 years. So excellent. We really focus on teaching you critical thinking, right? Have you been, what would you say, what is critical thinking? Let me see here. Who do I want to call on? Vivian, how would you explain critical thinking?
It's a systematic way of thinking about things where you take evidence and where you reason on it.
Yes, very good. Yep, taking in all that data, right? Giving that data meaning, looking for the relationship between that data, adding your knowledge to it. Yep, that whole systematic process. Very good. That was a very good explanation. Thank you. Yeah. And we're going to educate students who will exit the academic experience with a sense of confidence and a certainty in the adequacy of your nursing education, right? We're going to and promote the best evidence-based patient outcomes. Why is it important to use evidence-based practice in our nursing? How would you explain that, Madison? What is evidence-based practice?
It's just kind of collecting data and making sure it all equals up, and just like a correlation between your findings, I guess. Just having evidence that supports it.
Yeah, what kind of findings? Oh, you went on mute, sorry.
Did you ask me a question too, another one?
What kind of evidence? What makes it, yeah.
Just
where do we get the evidence from?
Evidence that you can prove? Oh.
Okay, so one of the roles that you might find yourself in, a lot of hospitals have on their units, they'll have unit-based practice teams, right? And so we had a pediatric clinical practice team, and they came to us, and we have, you know how patients have central lines, right? And you monitor, you actually audit central line infection rates. And we had a 0% central line infection rate for years, right? We had very good practices with doing dressing changes. But they came to us and they said, here is research studies, right? So you do a review of the literature, or people get familiar with new research, new practices that are coming out, right? So you do controlled research studies, right? Where you have, like if we wanted to know what are some of the new medications that, you know, the antivirals and things that are out there, the anti-malarial drug and the other, you know, medications, the one, you know, for one of the arthritises or something that they were using for COVID, and they needed to know, are they effective treatments, right? So they do research on it. They have a controlled group, and then they have a group that got the medication, and they see what the outcomes are. And then you have to look when you're reviewing research, was this a good study? Or, you know, you critique it and you see where they're, you know, did they have a good enough group of participants? Did they control for variables? You know, were they slanted? Was it done by the drug company? You know, and is there reasons why this isn't a good study? And then you look at multiple, you know, replicated studies that the same findings, you know, you look at the statistics and make sure that the outcomes are, you know, valuable, that they're, you know, they benefit the patient enough, without side effects and stuff too, right? So you look at researched, this is out of, so like, for example, American Heart Association, the number of compressions, doing 30 compressions and 2 breaths, it changed from 15 to 2 to 30 to 2, because they looked at interthoracic pressures and outcomes of codes and said, you know, compressions, maintaining circulation is really important, stay on the chest. And out of that research, and they have level 1, you know, level A through E. So they have different ways of evaluating the benefit, you know, of that research, the quality of that research. So evidence-based practice is taking researched outcomes and applying it to the clinical setting. So we don't want to say, oh, we did that. We always do this. You know, that's been our, you know, it's our tradition. We always, you know, change the linen every day. Well, why? You know, what's the evidence that indicates that this is a benefit to your patient, other than just raising healthcare costs? Does that make sense? Right? So when they came to us and they said,
you had a few people that were kicked out of Zoom. I don't know if you saw those messages.
Okay, I was watching. Thank you. I just noticed. It's funny. Just as you said that, then they popped up to be admitted. And Trevor. Okay, there. You guys are back. Sorry. So I was talking about what makes a practice evidence-based practice, right? And it's based on research findings that that have been good, good, solid, replicated research findings that a practice is beneficial. And I'm giving this example of on a clinical practice team in pediatrics with central line infections, we had a 0 infection rate, but they said this is a new practice to do the head to toe chlorhexidine bath, the bath wipes. Do you want to implement this as a new intervention? And we said, yes, if it's the latest evidence-based practice, that says that that's the best practice out there. Yes, we want to be doing it. And they said, well, if you're going to say that's your standard of care, you're going to have to be documenting it. You're going to have to be compliant with that. And we said, of course we will. And, so now they do that. They do. And that's like a standard of practice in most facilities to do daily chlorhexidine wipes to prevent central line infections. Another one is oral care with intubated patients to prevent ventilator-acquired pneumonia, because the bacteria can migrate down the ET tube into the lungs and cause pneumonia from being on the ventilator. So that was another one that came out of, whether it's a nursing idea and the nurse thinks this is good practice, I'm going to research it, and I'm going to have people who don't get oral care and people who do, and we'll see, who has less chances of pneumonia, or physician outcome, or whoever holds the study. But nursing research is another whole area of our profession, so we need research to be able to change practice and have evidence-based practice. Okay. So let's get through this and we'll do it and we'll have a break. So our core values. So I'm going to keep going forward. So as you're looking at all this, the community, the communication and compassion and all this, in our student handbook, I think it's like maybe even page 48 or 58, there's a picture of this mandala, and each one of the limbs, there's the different values, the core concepts, and then right at the center is our mission and our philosophy and our core values. In the circle around there are all your different concepts, your professional nursing concepts. So it's just kind of cool to have this conceptual based. I think sometimes people think conceptually based means like an abstract type of nursing program, right? But our content is very concrete, right? It's things that we can see in the person, everything. So I don't want you to look at this conceptual base curriculum as something abstract, because I think it's just the opposite, So a concept is not like an abstract idea. Okay, so let's go ahead and take a break and come back at 4:11, please.
Miss Erickson?
Yes.
I got kicked temporarily.
I know.
I did make
3 of you. What happened?
I don't know. It just said internet connection unstable, and then I went and checked my internet options, and sometimes it my computer connects to the Xfinity City Wi-Fi since I have internet from them. So I think when it made the switch over, it just kind of kicked me out.
Yeah, but you got back in okay. But I'll post the video. So if there's anything that you feel like you missed, you can go back and just kind of fast forward through it and then find that section, and then, yeah.
All right, thank you.
I'll always post the lectures, but I don't think you were kicked, because one moment you were there and then I saw you come back into the chat room not long after.
Yeah, that same thing happened to me.
I saw, yes. Yeah, it's okay. We can thank Jess. I think Jess actually, yeah, Jess private messaged me and told me you guys were trying to get back in, so I watched for you.
Well, thank you.
Thank you,
yeah,
Jess.
That was nice of her. I'm glad that she gave me a heads up, because sometimes when I'm talking, I don't see that you popped up in the waiting lobby.
Yeah, my internet has been going in and out all day.
So frustrating. Hopefully, maybe it's just today because of the rain, huh?
Yeah.
It's good to have you in class.
Oh, thank you. I'm glad too.
I remember having you in open lab like a long time ago.
Oh yeah, that was like in February.
Uh-huh. Hello. Okay, is everybody back? So this last hour, we're going to talk more specifically about health promotion and maintenance and remembering the definitions of our concepts, right? What it means to be healthy and what it means to be well, right? What are the difference in that? So health is more than the absence of disease, right? It's paying attention to all the different aspects of the human being. So wellness is that state of being healthy and practicing that healthy lifestyle. So and holistic is looking at all those human dimensions, whether it's the physical dimension, the spiritual dimension, our intellectual, emotional, right? So we have those 7 different aspects of the holistic human being. And each person defines health in terms of his or her own values and beliefs, right? Somebody can have hypertension, but they could be very physically fit and be on medication that controls their hypertension. And they would look at themselves as having a high state of health, right? That they're in very excellent health. You know, we look at, I think your book has that continuum, right, of health. So you think about like your Olympic athlete, right, at that very highest level, crosses the street, gets hit by a car, now they're dead, right? And they're at the other continuum. So the two end aspects of it. So, and I especially like how we can discern the difference between disease and illness, right? So, for example, you know, we have the disease, the virus of COVID, or COVID-19 is the disease, right? And we can screen for the disease. We can do testing to determine if the person has the disease, right? But the level of illness is another aspect of how that disease is shown. You know, how does it how does that person respond to that disease? Some people are very mildly ill, right? They say, oh, that was nothing more than like mild allergy symptoms. Where then you have your other person who ends up, you know, in prone position on a ventilator 4 months and has, you know, scarring of lung tissue, has cardiac damage from the virus, you know, kids that have the disease and then later have this vascular response reaction that looks like Kawasaki's disease or something, right? And is catastrophic. So you have the disease itself, and then you have the way that it manifests itself in illness in the human being, right? And then when we look at diseases, how do we define whether they're an acute disease or whether it becomes a chronic condition, right? And that's if the person has that illness for 6 months, right? And chronic disease kind of defines itself by having these episodes of kind of being in remission or not being as evident, being more controlled, and then kind of exacerbating, right? So we think of like reactive airway disease. You know, people will be like, I haven't needed my inhaler for a year. And then they go on a trip and somebody has perfume on and somebody's smoking, and then they get this viral, and then the next thing you know, they're in the emergency room struggling to breathe because everything has now triggered an exacerbation of their chronic disease, right? Where you look at an acute disease as being more like you fell down, you fractured your ankle, you have a cast, it heals, and you totally recover from it. So now that was just an acute episode. You know, months later, you're fine, you're walking stronger than ever. Full range of motion, right? So any questions on health and wellness, disease, illness, and chronic versus acute disease? Kind of quick review. Somebody want to give me another example of, see, I have pneumonia and appendicitis for acute, and then COPD and diabetes for chronic. What would be another chronic disease?
Chronic migraines.
Okay, yeah. Somebody who has, they go on and on, right? Maybe for years. And what's interesting about migraines too is, you know, we see so many of those in teenage girls where they get these intractable migraines because they have hormonal changes in their body that kind of triggers that. And then they have that, yeah, throughout their, yep, chronic migraine. Good. Okay. Well, get you thinking of some more, right?
Hypertension.
Hypertension. Yes, that's huge, right? Yep. Because that's something usually, it depends, somebody can diet and exercise and everything, and maybe it, it resolves and then they can get off their medications. But I think they're always, it's so idiopathic, so genetic usually. Yep. Hypertension. That was a
Another
really
one.
good, yeah.
Oh, sorry. Another
Go,
one
go.
could be chronic thyroiditis or Hashimoto's disease, because it's
Yes.
ongoing
Yeah.
through your whole life.
Once you get part of your thyroid removed, you're always going to have to be on thyroid supplement. And that's the thing too, right? Because that can be really can't it be frustrating for people when they're like, I'm always going to need this now, right? For people with diabetes right now to think that they're always going to need to have supplemental injections of insulin. But just encouraging them then to say, yeah, but the more, when you manage your disease, then you won't have all these negative consequences. If you really have good blood sugar control, or if you take your thyroid medication every day, right? You won't have the same level of disease and illness that somebody else, you won't have the same level of illness somebody else will have, right? Those complications. Good. Okay, I love this slide, right? Because, health disparities, this is a big thing on the news right now. And I think it's really important that we kind of understand that, people don't have the same level of care, right? People who have higher incomes have basically longer lives, right? They have better access to food, they have better access to parks, better access to health care, and better quality of life and health outcomes. So we have these health disparities in our country, worldwide. Being fair and the same isn't the same as being equitable, right? Having the same opportunities for each person. Looking at human life is something that all people should have access to healthcare. All people should have, the ability to self-actualize in our society. What benefits our society the most? Having that opportunity for everybody, and having every human being having the opportunity to live to their full potential benefits all of us, right? So as nurses, I think that's kind of that, aspect of that human and that human dignity that we value. Now, how you achieve that, then, we'll stay out of the politics or the other things with it. But that alone, valuing life and human dignity, and looking at, inequities and our vulnerable populations, right? And advocating for the vulnerable populations, looking at these health disparities, right? So things that create, different social and economic disadvantages, we look at those as being social determinants of health, right? What our income is, race and ethnicity, disabilities, education level, health insurance, and sexual preference all contribute to things that can determine, social factors that can determine our health status, or the health status of populations. So when we're looking at health promotion and identifying those risk factors, right? We have in the human dimension, that physical, the sociocultural, the environmental health risk factors, spiritual risk factors, emotional and intellectual risk factors, right? The different dimensions of the human being. So we look at, are their basic needs being met, right? And what is the person's self-concept? And we can apply Maslow. Remember, I know you all know about Maslow's hierarchy of needs, right? So, and then when we're looking at the risk factors on those different aspects of the human, are they modifiable or are they non-modifiable? So we, as nurses with health promotion, we're going to focus on the modifiable risk factors, right? Can they lose weight? Can they stop smoking? Can they eat more healthy and cut down on their, do you know that you're only supposed to take in 2,400 milligrams of sodium per day. And when you start counting your sodium, that's not very much, right? Or under 2 grams. They keep cutting it down. I think every time I look at it, it's like less salt, right? So, and how important, that is, because sodium retains water, it contributes to hypertension, right? So exercise, of course, is a modifiable. You know, if you have a sedentary lifestyle, if you have unsafe sexual practices, that's a modifiable risk factor, right? Not wearing your seatbelt, not wearing a helmet. So we could go on, right? You're non-modifiable. You can't change if you're male or female. You can't change your age. You can't change your genetics unless you get a bone marrow transplant. And then you might get some different genes. So anything else that we can't change that's not non-modifiable? Those are the main ones. Your race. You can't change your race. Your ethnicity. Okay. Who wants to give me an example of primary health promotion? Tawny, do you have an example of primary? What's a primary health promotion intervention?
Immunizations.
Yes. Yep. That's like the first one that comes to mind, right? Prevent it in the first place. Yeah. Any others?
Physical exams.
Yep. Getting regular physical exams. So we're not talking about screenings, right? We're talking about having this primary health practice, primary care. Yep. Who else? I heard another one.
I had said mammograms.
Well, okay, so mammograms, if you're looking at screening, that's secondary, right? If you're looking at teaching breast self-exam as a health promotion practice, then that's primary, right? Self-testicular exam, self-breast exam is an example of a primary health prevention. You got a practice in place that's going to help prevent it. What about daily sunscreen? Primary health promotion? I would think so, right? Preventing skin cancer in the first place. So, but if we're going in and we're doing skin, well, okay, so if we go into our doctor and if it's a routine thing that we're always following up and doing skin cancer, so the key word is screening for secondary, right? Once we're doing blood pressure screenings or like skin cancer screening, then it becomes a secondary level of health promotion. Colonoscopy. What would you give that one?
Secondary.
Secondary, yes. Okay. Anybody want to pull out the book and read the definitions again to kind of review? So I always think like primary is something that's going to prevent you from getting it in the first place. Secondary is screenings that's going to pick up on it when it's not very progressed, right? So you're going to catch it early so that you're screening for it and you're able, you know, it might cure it, right? That's the idea. You're catching it right away. Tertiary is it's already happened and you're learning to deal with it and maintain a high, you know, a high level of function. So Kaylee Engel, give me an example of a tertiary health promotion.
So like for a healthcare provider, it'd be probably like giving out resources to a patient for like a rehab center and stuff like that, helping them manage something that has already happened.
Yes, exactly. So you have a patient who's had a stroke and they're going to go follow up and go to PT in a rehab area to try to regain the ability to feed themselves. That'd be a tertiary health promotion activity. Managing diabetes, further diabetes education is a tertiary healthcare promotion activity. Helping somebody maximize their nutrition so that they're maintaining their weight during cancer therapy. Support groups for people with cancer. Okay. Teaching somebody how to manage their COPD so they don't experience COPD exacerbations, and how to look for activities that tire them out and cause exacerbations of their COPD would be a tertiary health promotion activity. Teaching somebody their their inhalers and their preventative inhaled steroid to prevent themselves from getting asthma exacerbations is tertiary health promotion. Okay. I think one of the hardest aspects of the levels of health promotion is determining some of the primary and secondary ones. Like, is it catching and preventing the disease in the first place, or is it screening for the disease, right? So just kind of get those two. Go back and review, the definitions in the book so that you can. Okay, so we have different models too that we can kind of apply to how we, implement health promotion and illness prevention. So, and we can really, isn't it great when we have like a contemporary, exemplar out there like COVID to look at the health belief model, right? So how does somebody perceive their susceptibility to the disease, right? If you're like, most of you guys, I bet, feel like your susceptibility to COVID is probably pretty low, right? You're probably not really worried that you're going to end up in the ICU in one of the hospitals on a ventilator, because you're looking at the numbers, right? You're looking at, the level of, if it's at 5%, right? Maybe when it was 12% and they started talking about, maybe there were some doctors on the news that were being interviewed talking about how they're seeing younger people now coming in and having complications that kind of made you, or maybe you were just thinking, I don't want to be part of this problem. I'm going to just wear my mask because I don't want to spread it to people at home and be responsible for that. I'm just going to, wear my mask. But, I think most people don't feel like, like they're that susceptible to dying from COVID. Or their perceived seriousness of the disease. If it hits home and they've got a family member now that has been in the hospital, or somebody that they know has lost a family member that has died, they might perceive it as being more serious, right? And then the perceived benefits of the action. Do people understand how important it is not to, touch things and then touch their face? Are they even aware of touching their face, right? Or do they understand, like when they look at, wearing a mask and when they're breathing, that they can't blow out a candle, how much filtering that's doing of those droplet particles? Do they understand the benefits of that action, right? So, that it's interesting how we behave in our health behaviors connect very closely to what we believe. And then health promotion model, right? For us, talking about how we can, teach people. I used to love it when parents would come in and they bottle prop. Something as easy as bottle propping. They wouldn't think too much of it. The baby's falling asleep. They don't want to stand there and hold the bottle. So they, do a little rolled up, blanket and position the baby so the bottle's right there, and, with some formula in it. And being able to explain to them that we don't allow that practice in pediatrics, because as babies are falling asleep, they can actually aspirate some of that formula, and some of it can go into their lungs and cause pneumonia. Or even more common is that the babies will kind of fall asleep and they'll allow that milk to pool, and then it inflames the eustachian tube of the ear, and it can cause chronic ear infections, which might not seem too serious, but if they get chronic ear infections and they have limited hearing, and then they don't develop their speech normally, and then that can lead to learning issues, learning disabilities in early childhood, which then can put them behind in learning for the rest of their life. And we see that very commonly, with children. And a lot of times this can be like a cultural practice in Tucson, Arizona, so, it can be looked at as a comforting kind of cultural thing. But when you, as a nurse, explain that this, how this happens, I have had so many parents, and, of course, you're saying this to them after you've kind of developed a rapport with them, right? You've gotten to know them, you've taken care of their child, maybe you've helped with the bath, you've given them a break so they could go to the cafeteria. You have this rapport with this parent that then you can kind of tell them, give them this information and say, this practice can be dangerous. Your child could choke and not be able to clear their throat, and that's why we don't allow it. But it also has these complications. You don't know how many times they've turned to me and said, nobody has told me that. Nobody has explained that to me. I'm going to stop doing it. What's the easiest way to get them off of this? And it's like, okay, we'll substitute water first, and then, pacifier is a much safer option, that kind of thing. So, hold the baby, feed the baby, lay the baby down, give the baby a pacifier, pat them until they go to sleep, So, and helping them with that. And then you've helped them change that practice. You guys there? Because I think you're froze again. Meeks, did I lose my internet? You guys there? You're there.
Here.
Stacy's there. Okay, it's just frozen on my other. Oh, you're back. Okay. Sorry. When people freeze for a moment, I've had that happen, and then it has to. Thank you. Okay, moving on. So we talked about the health illness continuum. So then there's the agent host environment model too, right? We were hoping that when it got hot enough in Tucson, it'd burn off the virus and we wouldn't have a good environment for the virus and it would go away, right? But it didn't. It survived the summer. So, and then of course we have to have the agent, which is the COVID. We have to have the host, which is the human being. It can live on surfaces for hours, right? But it needs to go from person to person. And then those stages of change, right? So I talked about how there's did I already talk about this as I was introducing class, right? How there's 4 stages, you're contemplating, you have that pre-contemplation, right? I'm thinking about losing weight. And then it's I'm really gonna commit and say, okay, I'm gonna come up with a plan. I talk to somebody, I formulate that plan to lose weight. And then I put the plan in motion. I'm journaling all of my food and looking at how many calories. I'm counting the calories for the day, and I'm implementing exercise every day and making sure I'm getting an hour of exercise every day. And I'm taking my weight every day and recording it, right? And then I move into that phase where then I'm incorporating that new change, right? I'm only eating so many calories a day and watching and making sure I'm not drinking any soda or, right? Limiting sugary sweets to one little dessert at the end of lunch, and that's it. So that I'm maintaining my weight. That's all it takes, right? So easy. You guys do kind of keep freezing on me, so I'm sorry if I, okay, you're moving again. Okay, so I'm not losing you yet. Okay, Maslow. At the base, right? Our basic needs, physiological needs. We need water. Can't live long without water. We need food. Right? And then it moves into that safety and security, right? We need to feel safe. We can't feel threatened. We can't be in flight and fight all the time. Love and belonging. We all seek to have that social connectedness, to feel that, to love and be loved, right? We need that. We need to feel good about ourselves and have that self-esteem, to feel that self-worth. And then at the very top of it is living to our full potential, to have that spiritual connectedness with our higher being, with our awareness of our higher self, and really feeling like we have everything that we need to then reach that full potential, right? So what's interesting though is it reminded me very much of the food pyramid, right? Is it really that simple? Isn't it more kind of like a my plate, where you kind of need all aspects of things too, and sometimes you feel like you've got this but you don't have that, and I just think it's kind of, I want to kind of challenge this nice little pyramid sometimes. And one example I have of that is, do any of you remember, did you watch the movie Spotlight? Michael Keaton was in it and Mark Ruffalo was in it, and they were investigating and uncovering the sexual abuses that were happening in the Catholic Church. And for these young men, there was one scene in particular where this young man says, when your community, the small community, was so invested in this, in this Catholic faith, so he said, when everything you are and believe relates to this church and this faith, when you get abused at that level, that's such a deep abuse, like it made him question everything about himself, right? So it really kind of, to me, when he was explaining this in that scene, this young man, I thought, wow, they just turned Maslow on its head on the point where the self-actualization is, and they crumbled it, and everything crumbled from that point, right? It like he described himself feeling like everything fell apart, right? And so he was suicidal, and he didn't know who he was or where right? It like shook him to his absolute core being. So I thought that was kind of really interesting. It made me kind of look at Maslow, and I think sometimes we think one thing builds on another, but then if that turning on its point and then having it all crumble beneath itself too. So I don't know. My deep thought for the day for you. So remember, we can have different theories that then can be applied and used in nursing process 2, theories about, growth and development, for example, right? Learning theories, that we can use to apply to our patient needs in nursing process. So Maslow can provide a framework, right? But each person, like when somebody comes in and I used to always ask, do you have any cultural needs? No.
Ms. Erickson?
Uh-huh.
Sorry, excuse me. Esme got kicked out.
Oh, I don't see her popping up yet to get back in, but I'll watch for her. Thank you. Okay. I'll watch for her to wait. So hopefully her internet gets, just so you know, if any of you do get kicked out, I will post my lectures. I'll post a link to YouTube. So you'll have them. Just take a note of the time that you miss, and then you can scroll forward in the lecture unless you want to watch the whole thing over again, right? Okay, so it will be there. So don't panic, and just let me know so I know that you weren't absent, that it was an internet issue, okay? So just remember that when we're planning care, we have to plan it. It is person-centered, right? What is that person's priority? If you're asking about cultural needs, spiritual needs, and they're in pain, they're like, I'll talk to you as soon as you can get me out of this excruciating pain. Give me pain medicine, and then we'll talk about what I want to learn, So also, the person just isn't the person, right? They're the person in context of the family. And, we have to recognize that that person, is going to go back to that family, is going to go back to that whole structure. So if we're wanting to promote health, it's not as effective if you're just, targeting the individual. It's a lot better if you can get these kids, into, I know one of the physical therapists at TMC had a program for weight loss and exercise for children. They identified obese children, but then they got their parents coming and learning recipes, trying recipes at home and doing exercises and things. And, especially with kids that are newly diagnosed with diabetes, involving the family in the education and explaining that, hey, you get pizza at home, nobody eats the pizza until the kid with diabetes is ready to eat the pizza too, right? So, the nuclear family, a lot of times they have the same values and the same beliefs. So, a family is defined as two people who depend on each other. They share the home, they share, that relationship, that family relationship, and it's not determined by sexual preference, married or in a committed relationship, right? There's many different definitions of family. So you can have extended family with aunts and uncles and grandparents, multi-generations living in the same home, blended families with people who are remarried and bring children into the family, single parent families, and other families. So adoptive families, of course. So we think about those functions and the role of the family, right? What needs do they, that emotional support, that education, providing health care, providing for the health and wellness of the people in the family. So the role of development, health activities, beliefs and values, making those decisions in the family. And, the illness doesn't just affect the individual either. It, affects all the roles of the family. It affects the siblings when attention is given to the person who has the illness, right? There's fear if somebody who's providing for the family then gets ill. It, it affects everybody. I would love to go into a room and, I could see this family struggling with the situation and just being able to say to them, I understand you're in crisis. and to see them look at me and for them to realize that they are in crisis and, you know, that they didn't expect this illness, that now, you know, they didn't expect to have to find childcare for the kids at home while they're in the hospital, or who's going to feed the dog, or who's going to let the horses out, right? All these things that have thrown them into crisis, you know, and these fears about how long they're going to be there and what's going to happen to their loved one, you know, and how this, what they're going to have to learn and how this could change their life, you know. Illness can be part of the crisis. It can also precipitate other crises, right? When there's a child born with health issues and it puts increased stress on the marriage and things too, right? When we would have, like, for example, that submersion injury child, right? And you just know the stress that that's going to put on that marriage. And the nurse right at the beginning helping to intervene and help them support each other, right? Not blame each other, right? Look at what happened and how you can help them all heal, help that family unit heal, help them be there for their child. So I'm looking at risk factors for the family. What's their family structure? What's their economic status and their living situation? What's the cultural and religious background? What are habits that the family has? You know, how do they celebrate holidays? And, you know, how do they define health, and how do they cope with stress? And what, you know, what's their support and who can help them? Who do, you know, and who do they want to know? Who do they want involved in their care? And then, you know, going a little bit bigger and into the community. What are the community supports, right? Like for me with Parkinson's, you know, I couldn't be in a better city, really. We have trained neurologists who are movement disorder specialists. My physician, Dr. Reed, trained at the Muhammad Ali Center for Excellence in Phoenix. We have the Parkinson's Wellness gym. Becky Farley, the physical therapist there, did extensive research into specific exercises that help people from progressing with disease instead of becoming smaller and more contracted. She looks at ways of moving bigger and moving with more purpose that can help with some of the pain and dystonia that people with Parkinson's have. And then having a really great the American Parkinson's Disease Association having online support group meetings and those kind of things. So looking at what resources we have in our community and, you know, nationally also, right? The healthcare structure, what is our access? Can I, you know, call up and get an appointment with my primary care? Or is there a lack of primary care physicians in this rural community that, you know, even if I had insurance, I have to wait so long to get in to see my doctor, right? So, and then, you know, do I have a car to drive to the doctor, or is there a good bus system? Or, you know, so what are my resources? And, you know, what's the air quality? What's the water? What's the sanitation? You know, all those kind of things too. What are the parks like? And what are there colleges? Are there, you know, community colleges? What's my access for education also? So all those different things when we're looking at community resources. And then, you know, also, you know, including churches and, you know, food banks and other community support organizations. So you look at, you know, the individual and then the family and the member of the community, and you look at, you know, values and beliefs in that community and healthcare resources, transportation and communication facilities, protection, safety, aesthetic concerns, production of services and goods, you know, grocery stores and farmers markets and things like that, education and recreation programs to look at the wellness of the community. So, you know, community health nurses can look at prevalence and morbidity of disease. They can look at mortality. You know, like all of a sudden, if we start seeing a lot of deaths related to drug overdoses or those kind of things, you know, we would look at the community as a whole and looking at those numbers in terms of health promotion and maintenance. Okay. So next week, we're going to look more specifically at cultural concerns and how we also include, you know, those cultural beliefs and practices and complementary therapy and alternative medicine that ties into our health beliefs and culture. And then week 3, we'll have exam 1. Okay, so just to finish up for today, the assignment that is 1% graded is a discussion board. So I have kind of this, what's the word I'm looking for? Tradition. It's a tradition that I have where as you're starting out, I kind of look at this class as starting you out on your professional nursing career, right? It's your first NUR nursing course. And this is a horrible video about a little girl who died, Josie King. Her mother tells her story about how her daughter was admitted to Johns Hopkins University. So I have those links posted in week 2 content folder. So, you know, after this lecture on talking about, you know, our professionalism and evidence-based practice and, you know, kind of your role as a nurse, watching these videos and looking at, you know, what were some of the root causes of some of the mistakes made that led to Josie's death. So the explanation of the assignment is in Blackboard and the rubric is posted. So I want your like a 3-paragraph initial post. Okay. Oh, now I see Esme. If she was waiting a while, she showed up on my laptop, but she didn't show up on my desktop. So I wonder how long when I turned here, I saw her. I'll have to apologize to her if she was waiting long. Okay. Let's see if I can pull up Blackboard. You guys, are you able to look in Blackboard, guys? You know, if I leave it open for too long, how it like needs you to re-sign in and then it takes forever. Does anybody else have that happen? Yes.
Yeah, that happens. So this is a discussion board. Is that what it is?
Yes.
Okay. Thank you.
And it's 3 posts total.
Oh, three posts or 3 paragraphs?
Okay. Your initial post is 3 paragraphs.
Gotcha.
That's going to be your first post. Okay, so I'm going to share the rubric right here.
Okay.
Okay, so let me share this. Let's see if this works. I think it might be here. It went black. Come on. Oh, there it is. Oh, no, close that. I don't know. I'm not going to end the meeting. Why is it telling me to end the meeting? I'm not ending no meeting. Not yet. Okay. No idea why this is showing. We love computers. We love computers. We love computers. Haha. Okay. Now. Come on, open. Mine's open. It's better. Okay. I gotta talk to it. Don't mind me while I talk to my computer. Any day now, open. Are you guys seeing the black screen?
Yes.
Yes.
Maybe I'm gonna mess it all up. Oh well. Let's try it again over here. Third time's a charm. There we go. Now you can all see it, correct? Get bigger. Okay, so initial post, your 3 paragraphs, commenting on substandard practice. What were the root causes? What are you identifying as the, so what was substandard? What caused that substandard practice? What would you change to make it better? You're going to post your 3 paragraph, cite sources, kind of research what you're saying, defend what you're saying with professional journals, and post that by the end of the day, Thursday. Okay. Friday at midnight 01 is too late. Do it before. You shouldn't be up that late anyway, right? Time management. Post it end of day on Thursday and get to bed, get a good night's sleep. Then you have to the end of day on Saturday to read through them and make a note, and if you see somebody's commented on one of your fellow students, pick another student who hasn't gotten a comment or a question. Comment on theirs, right? I want everybody to get a comment or a question. And then by Monday, before class on Tuesday, right? By end of day Monday, I want you to have all of your responses to the comments, answers to the questions in there. So you're going to have 3 total posts. You're going to have your initial post, your comment or question to somebody, and then your response to those comments or questions on your post. And that's going to be done by end of day Monday. So on Tuesday, I can review them all and we can have a little bit of a discussion about the Josie King. Then we're going to look at cultural influences and cultural assessment, which I tell you, I feel like I need to give it again prior to you guys going into clinical, because when you're filling out your clinical assessment form, I feel like people still miss things on their cultural assessment. And then we'll do a little breakout activity next week. Okay? Questions? There's prep-use that are assigned. They're not graded. They're not a ticket in. Approach them like you do your reading assignments, okay? I have assigned them. When you do them, you will learn. You will prepare for the test, okay? So if you don't get all the way to the mastery level, then you better do well on my test, right? Because then if people don't do well on the test and they didn't do their prep-use, then I will assign them and I'll make them ticket-ins.
Are the prep-use open already?
Yes.
Okay, because I can't.
Did you? I did send out an announcement.
I can't seem to find them for.
They're in the point. You know how to get to Walter Kluwer's, the Walter Kluwer's website? Did you see my announcement with, so you're enrolled in the class?
Yes, ma'am. Yeah, I know how to get to them. It just comes up as a blank page when I click on the class itself.
Is anybody else getting that?
Is your screen only taking the page, is it only taking up half of your screen?
What do you mean? Because I can log on to like our psych class and I did our prep-use for that already.
Yeah, so if your internet isn't like fully maximized, it won't show like the assignments listed. I know that's happened to me before. Like if you have 2 screens open, you have your Blackboard and then you have your Zoom on the same computer, it won't show you the assignments unless the point is like fully maximized across the screen.
But it's only doing it for her particular class because I can get into every other class and see the assignments.
Okay.
This is very sad.
You should ask Severson anytime it's like something with the point, because I know I've already done my prep-use, so I know they're there.
That 1-800 number, the support, I've had really good experience with the support people too with Walter Kluwer's.
So there's no word count on the discussion board for the initial response or our peer responses?
There's not, just three substantial paragraphs. So at least, like give me a good introduction of what you're going to talk about too. Three paragraphs about what was the substandard care, what is the causes, the root causes, and what would you change? And then you can summarize it also. So it's a nice Nice paper. Show me your good writing. So show me your professional writing. Cite your sources.
Okay, I figured it out. You cannot answer it through going through the class specifically. You have to go to Concepts by PrepU, which is really kind of, because like the vSim shows up, but not the PrepU's by itself. So whatever, I figured it out. So thank you.
About? So you go to, is this how you do it, right? My content, right?
So if I go to my content and then product
right here,
view.
you always have to go here.
Yep,
right here.
and then I go to product view and then
No,
PrepU.
look, adapt learning by PrepU. See that?
Yes.
You
but
went
on some of them, you go to product view and it says PrepU right underneath it. And so on this screen.
They updated the website. It used to do that, but it doesn't do it anymore, right?
Right, so on this screen, when I clicked your class, the only results that came up were vSims. But if I go to the Adaptive Learning by PrepU, that tab at the top, and then I click your class, and then it works. So I figured it out, but.
That's kind of workaround though. That's weird. Is that weird? I don't know why. Okay, so you got it though. Everybody's got it? Have you been ever in this medical terminology book? Do you ever play these games over here? Like when we get to oxygenation, there's nothing in here like for us right now. But like even my third semester, you know, when we get into like the reproductive system and stuff, these games are kind of fun. Quiz show and roboterms, and that's kind of fun. Okay. Well, it's time, folks. I know you thought 3 hours. What could we possibly talk about for 3 hours? Anybody else having issues with website, with Blackboard? You're finding all the content. You're getting my announcements. You're opening up your folders fine. No, you're not getting my announcements, Corey?
I'm sorry?
I said, are you getting my announcements okay?
Yes, I thought you were talking about like with the Zoom, like with the issues, and then you finished your sentence, so I said no.
Oh, okay. No issues with Zoom. No. Getting everything okay. Okay, here's another thing. And you can ask Jess, and you can ask Esme, and you can ask Monique if it's true. You email me. I will get back to you, okay? I will answer your emails. I'm okay with you emailing me. If I don't get back to you right away, just, you know, wait till I wake up or get out of the bathroom and I'll email you, right? So I don't want you to be frustrated about an assignment, not know when it's due, have a question about something and wait, you know, or anything like that, or worried about something, okay? Let me know if you have a question, an issue, a concern, a thought, okay? Feel free. You can email me, okay? If it's an emergency and you feel like I must not have seen your email, or you know, you can text me if you're thinking about quitting, right? If you've had it or whatever, you can text me. You can ask me if it's a good time to talk. We can talk, we can meet on Zoom, okay? I'm here for you, okay? Know that, okay? I know your name. I know, you know, you're mine now, okay? You're my student. I care about you, okay? You're my future nurse. You're my reason for being here, okay? Have a lovely evening. Keep in touch. I look forward to hearing your insightful views on Josie King, okay? You are free to go. If you want to hang out and ask any questions, I'll hang for a little bit. Thank you so much. Bye, Esme. Tell Jerry I said hi, Tani. Yeah.
Miss Erickson, I had a quick question. So for the discussion board, you do want a introduction and a conclusion?
Yeah, I think it says that on the instructions if you read it, it does. But I mean, I'm not going to like take off I'm looking for I'm looking for the content, really, the ideas, and you know, I mean, I
Okay.
want to see not a lot of errors in the writing, but you'll see how it's kind of broken down in the outline. But yeah, I like that in terms of good writing and, you know,
Okay.
giving a
And do
little,
you want it in an APA format, or do we just post it in the Blackboard?
no, I want like a APA.
APA, okay.
Yeah.
No title page, right? Or you do want a title page?
You know, in the instructions, I guess I didn't say APA format. I said references,
Mm-hmm.
but I didn't say APA format. So I'm not going to take off points for APA.
Okay.
So however you want to submit it. Yeah. So if you just want to post it in, yeah,
In the
that's fine.
Okay.
I want to do it as written. You know, whatever I have on the rubric is how I'm going to grade it.
Perfect. Okay. Well, thank you so much. Have a nice evening.
You too. Thank you.
Bye.
Bye.